Esto es tu guía en cirugía plástica.
Hello everybody, welcome to the podcast Tu Guía en Cirugía Plástica, Plastic Surgeon's Guide, and I am Dr. José Daza from Mexico City, and today we are going to talk about Ginecomastia, and we have an special visitor here, and welcome, Mathew.
Thank you for having me. Thank you for having me, doctor.
Thanks to you, Mathew, you're recovering from this procedure.
Correct.
Actually. Yes.
Correct.
How
Yeah.
long?
I got the procedure last Thursday, which is a week and a day ago. So today's day 8. And the recovery is coming along well. I haven't had any complications that we're aware of. So the recovery is coming along well so far.
What about pain?
Pain levels, honestly, I've never really had too much pain. The doctor prescribed me the correct dosage of medication that I've been taking. So I haven't really been suffering from any pains. There is a little bit bruising, and so when I touch something or I lay down, you'll feel a little bit of the pain from the bruising, a little bit burning. I still have drains connected to me, but nothing even close to what I consider painful. A little bit discomfort, but nothing too painful.
Perfect. Why did you decide to go forward to this procedure?
Okay, so the procedure is this is a plastic surgery. So to be honest, the first thing you think of plastic surgery is you want to look better. So that's the honesty. I wasn't suffering from too much pain, so mostly it was an aesthetic type of surgery. So that's why I wanted to do it, because I thought it would look better. And so far, yeah, as the swelling is going down day by day, it's looking better and better. Yes. And then secondly, it's more, there was obviously some more discomfort and stuff, mostly aesthetically over anything else.
Okay,
yeah.
Perfect. But your procedure, we actually took a couple of hours.
Sure.
But what we do during this procedure, it's liposculpture, but we also resect some mammary gland, which is not right now at the pathologist. It's very important to analyze it under microscope.
Absolutely.
In order to see that all the cells are okay. There's a wide relationship between cancer and gynecomastia, so that part is very important. So we will have your results in a couple of days. Wonderful. Just before you leave. Perfect. And everything will be fine. So did you have tell me about your background. How did you find us here? Because you flew all the way
from Los Angeles,
from LA.
Exactly. Yeah. The way I found out about this place, Boston Medical, and obviously this great doctor, is word of mouth. So I had some family come and they had some procedures done. And I've actually talked to someone in Beverly Hills in regard to getting the same procedure done. Obviously, it was a different price point, much more expensive. So our mutual friend had a couple procedures done with this wonderful doctor, and she loved the results. And I had some other family members have a couple procedures done, and they loved the results. And I reached out to the doctor. I said, when can I come in? He gave me a price point. I loved everything he had to say in regards to the recovery and everything. And we took it from there.
Thank you very much, because I know there is a lot of places you can do that,
right.
Even in Mexico, Tijuana.
Of course.
And there are a lot of fantastic plastic surgeons in California too.
Absolutely.
So it's very important to visit and experience
100%.
Plastic surgeon and a certified plastic surgeon.
Absolutely.
Even in California, you just told me that they offer one-day recovery liposuction.
Exactly. So when I had my procedure done, I was an inpatient for a day. I stayed here overnight, and in California, most plastic surgeries is outpatient. So they'll put drains and they'll send you home the same day. And here, ever since my surgery, I've been doing massages that you guys are aware of. And that rarely happens in the States, believe it or not. So recovery will take longer.
And painful.
Exactly. And if you guys know anything about America, we love to prescribe pain medications. So they have no problem, helping you with the pain with more prescriptions.
About.
Of course. Going back to the doctor's original question is how I really found out about this place is great word of mouth. Everybody who came to this place had nothing but great things to say. So
Okay,
that was
thank
very
you
important.
much. And how would you feel if you were left discharged back home the very same day?
Honestly,
Do you
great
remember
question.
the
Of
afternoon?
course. I mean, everybody's scared of surgery. There's no part of surgery that's scary. You're asleep.
Yes.
So the moment your eyes open up, you're no longer in surgery, you're in recovery. So the recovery aspect is the scariest aspect,
Yes,
right?
I know.
So I wouldn't feel good going home. I mean, especially if you don't have people, loved ones around you to take care of you. I mean, you're gonna go to your own apartment by yourself? It's a very scary situation.
Yes,
you
I know. Well, most of the patients who travel from abroad, sometimes they fly alone.
No,
So
exactly.
it's not a good idea
Agreed.
to charge them to the hotel room or Airbnb or wherever they
Exactly,
stay. So
exactly.
for me, it's the security stuff.
Exactly.
It's the security. I feel more comfortable having my patients here, even though they're looking Netflix.
Yeah, and you're not in too much
Yes.
pain, but you're in discomfort. So someone there to give you a cup of water, someone there to check your vitals, your blood pressure. If you remember, my blood pressure was a little elevated.
Yes,
So
yes,
someone
you had
there to
elevated,
check
yes.
that, that's very, very important.
So it's very important. I feel more secure, comfortable having patients here, even though it's not necessary sometimes. But if you have pain, if you nauseous, vomiting, high blood pressure,
Exactly.
low blood pressure,
Exactly.
dizziness, any symptom you can feel after a procedure, surgical procedure, former surgical procedure, will be good care by our nurses and the MDs here, and that is part of the quality of treatments and what we offer. And I feel very secure by doing that, because it can, if I hate having complications, so my goal is having the minimal complications.
Try to minimize it as possible.
Yes.
Of course.
We have pretty
And I could speak as far as the staff. I've basically met everybody here. I know you guys are basically all family as well.
Yes.
It's wonderful. And everybody's just super nice. The first night, the nurse was amazing. She said, if you need anything, hit the buzzer next to my bed. So I did. Came within seconds of me hitting the buzzer. Everybody was super nice. It's been delightful, to be honest.
Thank you very much.
Of course.
Will you come back?
Oh, 100%. 100%.
Okay, thank you very much.
100%.
Do you have some more questions for me?
Yeah, absolutely. When we initially talked, I did have some questions. So it's great for the public to know. A recovery time.
The average recovery time is 10 days.
Right.
When we do more, sometimes we do more liposculpture and rhinoplasty, and we do different procedures at the same times, you can actually go up to 15 days. But for all our foreign patients, none of them spend here more than 15 days
Correct.
for any procedure.
Right.
It depends. You'll be ready to fly on Tuesday, right?
Correct.
Yes.
Correct.
We guarantee, and it's very important to tell the truth. You were telling me that in California, you can find a lipo 1 day recovery.
Yeah, exactly. Yeah.
I don't think that is possible.
Correct.
And if I would tell you, you recover in 3 days, and then you arrange your job and meetings and everything at day 5,
it's not going to make
you
sense.
wouldn't be able to
Exactly.
do that. I don't like to play with people's time.
Yeah.
Okay, so I love being very punctual in that area. 5 days, 3 days, 7 days, 10 days, plus a couple of days.
Exactly.
But we never tell something that it's not going to be true. Okay,
Exactly.
that's very important.
Yeah. And Doctor, I got another question for you as well, is results. So everybody that gets surgery done, they want to see how long before I see results? And obviously after a procedure like this, you have swelling, you have inflammation, you have drainage. So my next question was in regards to results.
Okay, the results, you can already see them right now. Right?
Exactly.
It's 1 week and you can see the different shape.
Of course.
We actually did some fat transfer to the muscles and it looks very different.
Exactly.
But the final results are always, they always take 3 to 4 months. Okay, so it doesn't mean that you need to rest all this time. You'll probably be having your normal routine life, exercising and everything by the end of the first month, and then just wait a couple of months in order to completely heal and see the final result. Okay, so that's what it takes for this type of procedure.
Of course. And for our most our female audience who's listening, I know their main concern is scarring.
Scarring.
Exactly. You know, especially if someone has like a rhinoplasty or something that is very, you know, prevalent to the face or something that you can't cover up so easily. So my next question is scarring. How do we prevent that or make it noticeable?
Well, that's our secret.
Oh, there you go. So I guess
Yes.
we're not going to hear about it today.
Well, but it's not a secret.
Right.
All plastic surgeons, we know that there are places where you can have the minimal scar.
Correct.
And that there are places on the same body where you can have a very bad scar. It's not a secret. Bad scars, keloid scars are always, you can always get those type of bad scarring in very thick skin. Mathew, I'm very glad to have you here. Thank
Absolute
you for
pleasure.
the confidence.
Thank you. Thank you for having me, doctor.
Thank you very much. Thank you to all our foreign patients. You can follow us on our social media, Instagram, Dr. José Daza, and other media. Thank you very much.
Hey,
Mathew, say goodbye to everyone.
Hey, thank you guys for having us. Looking at the camera, thank you guys for having us. Absolute pleasure. Doctor is wonderful. I highly recommend it. If you guys are in Mexico City, come check this guy out. He's great. The staff is amazing. All thumbs up here.
Thank you very much.
Of course.
Bye bye.
Doctor, pleasure.
Acaba de escuchar Tu guía en cirugía plástica.